What is diabetic ketoacidosis, or DKA? Diabetic ketoacidosis is a serious complication of diabetes. It occurs when the body starts breaking down fat for fuel at a rate that is much too fast. This process produces ketones, which are acids that build up in the blood. High levels of ketones can be toxic and even life-threatening. DKA is always a medical emergency. It requires immediate medical attention. If left untreated, DKA can lead to coma and even death. Knowing the signs and symptoms as well as what to do can truly be life-saving. DKA primarily affects people with type 1 diabetes. However, it can also occur in people with type 2 diabetes, especially if they have certain risk factors. Understanding DKA is crucial for anyone living with diabetes and their loved ones. The role of insulin. To understand DKA, it's helpful to review the role of insulin in the body. Insulin is a hormone produced by the pancreas. Think of it as a key that unlocks the doors of our cells, allowing glucose or sugar from the food we eat to enter and provide energy. Without enough insulin, glucose can't enter the cells effectively. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This means people with type 1 diabetes produce very little or no insulin at all. They require daily insulin injections or infusions to survive. In type 2 diabetes, the body becomes resistant to the effects of insulin, or the pancreas doesn't produce enough insulin to keep up with the body's demands. This can lead to high blood sugar levels over time. Triggers. Why does DKA happen? DKA often occurs because of missed or inadequate insulin doses. When there isn't enough insulin, the body can't use glucose for energy effectively. As a result, it starts breaking down fat for fuel instead. Besides missed insulin, several other factors can trigger DKA. Infections, illness can stress the body and lead to hormonal changes that increase blood sugar levels. Certain medications, such as steroids, can interfere with insulin's action. Stress, physical or emotional stress, can also raise blood sugar levels. It's important to note that sometimes DKA can develop even if someone with diabetes is following their usual insulin regimen. This highlights the importance of recognizing the signs and symptoms early on. Who is at risk? While anyone with diabetes can develop DKA, some individuals are at higher risk than others. Those at increased risk include people with type 1 diabetes. This group relies on external insulin to survive. Individuals with newly diagnosed diabetes, they may not be aware of the importance of insulin therapy. Those with inadequate insulin therapy, missing doses, or not taking enough insulin can lead to DKA. Pregnant women with diabetes, hormonal changes during pregnancy can increase the risk. People with certain medical conditions, infections, pancreatitis, and heart attacks can trigger DKA. Recognizing your risk factors and working closely with your healthcare team is crucial for preventing DKA. Recognizing the warning signs of DKA is vital. The condition can progress rapidly, so it's crucial to be aware of the warning signs and symptoms. These typically develop gradually and may include high blood sugar levels. This is often the first sign of DKA. Excessive thirst. The body tries to flush out excess glucose through urine, leading to dehydration and thirst. Frequent urination. Increased urination is another sign of the body's attempt to eliminate glucose. Nausea and vomiting. These symptoms are often due to the buildup of ketones in the blood. Abdominal pain, stomach pain can be severe and is another common symptom. If you experience any of these symptoms, especially in combination, seek medical attention immediately. Don't delay, as early intervention is crucial for a positive outcome. DKA is a serious medical emergency that requires immediate hospitalization. In the hospital setting, healthcare professionals will work quickly to stabilize the patient's condition and address the underlying cause. It's important to remember that DKA can be fatal if left untreated. The longer it takes to seek medical attention, the higher the risk of complications. Treating DKA involves a multi-pronged approach aimed at restoring the body's chemical balance and addressing the underlying cause. The primary goals of treatment include rehydration. Intravenous fluids are administered to correct dehydration and dilute excess glucose in the blood. Insulin therapy. Intravenous insulin is given to lower blood sugar levels and stop ketone production. Electrolyte replacement. DKA can cause electrolyte imbalances, so electrolytes such as potassium are monitored and replaced as needed. The duration of treatment varies depending on the severity of DKA and the individual's response to therapy. Most people require several days of hospital stay for close monitoring and management. Complications. The domino effect. DKA can lead to a cascade of complications if left untreated or if treatment is delayed. These complications can affect various organs and systems in the body. One serious complication is cerebral edema, which is swelling of the brain. This can occur if fluids are given too quickly during treatment, leading to a rapid shift in blood sugar levels. Cerebral edema can cause seizures, coma, and even death. Another potential complication is acute kidney injury. This occurs when the kidneys are unable to filter waste products effectively due to dehydration and electrolyte imbalances. While most cases of acute kidney injury are reversible with prompt treatment, severe cases can lead to permanent kidney damage. Other complications of DKA can include respiratory distress. The body tries to compensate for the acidity in the blood by breathing faster, which can lead to respiratory distress. Low blood pressure. Dehydration can cause a drop in blood pressure, leading to dizziness, fainting, and even shock. Cardiac arrhythmias. Electrolyte imbalances can disrupt the heart's electrical activity, leading to irregular heartbeats. Prevention is key empowering diabetics. Preventing DKA is always preferable to treating it. Empowering individuals with diabetes to manage their condition effectively is crucial for reducing the risk of DKA and other complications. Key prevention strategies include diabetes education. A comprehensive understanding of diabetes, including its causes, complications, and management, is essential. Insulin therapy adherence. Taking insulin as prescribed at the right dose and time is crucial for preventing DKA. Blood glucose monitoring. Regular blood sugar checks help identify trends and adjust insulin doses as needed. By taking an active role in their diabetes management, individuals can significantly reduce their risk of developing DKA. Staying vigilant sick day management. Even with the best management, illnesses can still occur. It's crucial for people with diabetes to have a sick day management plan in place to prevent DKA during times of illness. This plan should include monitoring blood sugar levels more frequently. Illness can cause blood sugar levels to fluctuate, so close monitoring is essential. Staying hydrated. Drinking plenty of fluids is crucial for preventing dehydration. Continuing to take insulin. Do not stop taking insulin when sick, even if you're not eating as much. Checking for ketones. If blood sugar levels remain high despite taking insulin, check for ketones in your urine or blood. By following your sick day management plan, you can help prevent DKA and other complications from developing. The final word. Diabetic ketoacidosis, DKA, is a serious complication of diabetes that requires immediate medical attention. Understanding the causes, risk factors, symptoms, and prevention strategies for DKA is essential for anyone living with diabetes and their loved ones. By taking an active role in managing your diabetes, staying vigilant about your health, and seeking medical attention promptly when needed, you can significantly reduce your risk of developing DKA and other complications. Remember, knowledge is power, and early intervention